Good morning, everyone, and welcome to another Oregon Health Policy Board educational webinar. I'm Tara Chetok, and I'm the project manager for the board. And we appreciate you all joining us this morning for this educational webinar from the Medicaid Advisory Committee's subcommittee on their Advancing Consumer Experience Recommendations Summary. We are bringing this topic to you today for you all to learn more about the recommendation summary from the subcommittee. And then we will bring a formal presentation to the board. We're hoping for January, if not January, early 2022. So thank you for being here to learn about this topic. A couple housekeeping items. Today's educational webinar is for informational purposes only, and no Oregon Health Policy Board business will be conducted. I'd also like to point out that today's educational webinar is being recorded, and we will be posting a link to the recording on the board's website later today for those who can't join us live, or if there's any parts that you want to go back and revisit. One other housekeeping item is that the chat is turned off, so attendees cannot send a chat to each other, but you can send a chat to me or Annette Pierce, who are the co-hosts today. We will take any questions that folks have. We will prioritize questions and comments from the members, but if we have staff or folks from the public joining us, please send me your chat question and we will get to those at the end as we have time. And without further ado, I'd like to welcome Lavinia Goto and Jackie Wetzel from the Medicaid Advisory Committee to present today's educational webinar.
Thanks, Tara. Good morning, everyone. I'm Jackie Wetzel. I'm a transformation analyst in the Transformation Center at the Oregon Health Authority. Really happy to talk with you all today about the Advancing Consumer Experience Subcommittee work. Lavinia, do you want to say good morning?
Yes, good morning, everyone. I'm Lavinia Goto, and I'm a member of the Medicaid Advisory Committee and chair of the subcommittee on consumer experience.
Super. So can we advance the slide, please? So again, thank you for this opportunity to share information about the work of the Advancing Consumer Experience Subcommittee. Before we dive into the findings and the recommendations of this work, I'll provide a brief overview of the Medicaid Advisory Committee, or the MAC, and we are happy to answer questions or clarify information throughout today's webinar. It's a lot of information, so please feel free to raise your hand or put a note in the chat to Tara if you have any questions. Next slide, please. So the Medicaid Advisory Committee, or the MAC, is required by federal and state statute and advises the Oregon Health Authority and the Policy Board on Oregon's Medicaid program from a consumer and community perspective. The MAC can have up to 15 governor-appointed members. Current membership is at 11, so we are recruiting. And members bring many different perspectives to the MAC, including those of providers, advocates who work with many OHP members across the state, representatives of CCOs and healthcare organizations, and most importantly, consumers. Next slide, please. Oh, sorry. Our current work right now is focused on monitoring CCO 2.0 implementation from a consumer perspective. And the MAC has also provided input throughout the development of the 1115 waiver application from a consumer, reviewing that from a consumer perspective. Thank you. So a little bit about the background of the subcommittee. This work really started in late 2020 with the goals of understanding consumer challenges and identifying opportunities to improve consumer experience. Some of the known challenges that prompted this work include issues that arise when benefits or services are siloed across different agencies, problems that arise when coordination responsibility is unclear or roles are shared across multiple organizations, and challenges related to complex medical or psychosocial needs. Next slide, please. This is a subcommittee roster, and we just want to say thank you to all of the amazing people who participated in any part of this work, including subcommittee members, as well as the MAC members who provided guidance and feedback along the way. Before I hand this over to Lavinia, I also want to highlight that a lot of our early work of the subcommittee was focused on identifying sources of unfiltered consumer voice. And we have continued to build relationships with the community advisory councils. As many of you know, those CACs are the community engagement arm of the CCO model, and more than half of CAC members are consumers. So we have received some input from some CACs, but in general, I want to call out that there's no centralized reporting structure in place to support routine sharing of information. And I'm telling you this because I want to highlight that one limitation of this work is we don't have a perfect representation of input from members and populations in different groups across the state. So while I think that the information that we're sharing is all really valid, it's possible that there are other challenges that are really important that did not surface in this work. So again, just a huge thank you to everyone who helped with this. And I'll go ahead and turn this over to Lavinia.
Thank you, Jackie. So as you can see from our subcommittee member list, we have 4 consumers, 3 advocates who work extensively with OHP members, and 1 ombudsperson who works with many OHP members. And as Jackie said, a huge thank you to all those participants who participated in this work. So we spent the first 3 months listening to subcommittee members share their experiences. Many came from advocates who work with many of our OHP consumers across the state. And what we noticed is that as we collected the information from more than 50 OHP consumer experiences, that the concerns tend to fall into 4 themes or categories. These were those that were concerns around communication, the second one, care coordination, and then care transitions. And then also, I think what we learned as Jackie was sharing is that there was finding a place for unfiltered consumer voice to be heard was a challenge. So that's more or less the 4th concern. The next several slides will provide details and examples of the challenges that we heard, and the report includes the full list of concerns in the appendix. So Jackie?
Right, so with communication, what we heard is that people have a hard time finding relevant information that they need that's easy to understand. And people also struggle with understanding the information that comes from the many agencies and organizations involved in our healthcare system. And I think the consumer quote here sums this up nicely. I am receiving information from DHS, APD, OHP, Medicare, and Social Security in the mail and via phone. And most of the information contradicts each agency. Next slide, please. Here is just an illustration of what this can look like to a consumer. This is from an FAQ page about OHP benefits. And you, just by glancing at it, can see that in order to make sense of this, you first have to decode lots of acronyms and codes to maybe start finding what you need. Next slide, please. So another area where we heard consumers experience a lot of challenges is finding providers, and provider search tools are a big part of that. Some of the frustrations with provider search tools that we heard are that they're hard to find. They're not always consumer friendly. And we had someone highlight to us a specific example of a search tool that included 200 different provider types to choose from. Some of the comments that we heard: there is no list of in-network providers to choose from, hit or miss if a provider will take the card or not. Parents just have to call and call and call. That comment is from someone who is enrolled in fee-for-service Medicaid, also called Open Card. And then we also heard or received this note: 7 different searches for a pediatrician in Portland returned 0 results. Next slide, please. Here, this is just a snapshot of what I mentioned before, this very long list of provider types. I'm going to call it a couple. So DCO capitated provider, delegating NSGRN. These are just not consumer-friendly categories. And of course, the challenge is that if you have so many different provider types to choose from, if you do receive 0 results, you're not exactly clear if that's because you chose the wrong provider type or if there are truly no providers that you need in the area where you're looking. So that's a challenge. Consumers shared many challenges related to denials, which are also called no ABDs, which I have seen stand for notices of adverse benefit determination. And I've also seen it labeled as notice of action / benefit denial. Consumer challenges related to denials include unclear notices with industry specific terms, denial reasons that are in code. And then we also heard about late notices, for example, the day before a procedure that has maybe been scheduled for months. And of course, if you've taken the time to prepare for a procedure emotionally and logistically, that's really challenging to have that canceled the day before it's scheduled to happen. Consumer comments related to denials include, how can I participate in an appeal process if I don't even know why the procedure was denied? And also, I have 2 college degrees, but had to get help from an attorney to understand the notices I received. I want to share really good news that over the past several months, OHA has done extensive work in this area to translate denials into plain language and make the information more understandable for consumers. Next slide, please. So this is a real live denial. A little bit of it is redacted for privacy. But in that second block of text, you can see an illustration of what we heard, that you've got denial reasons that are presented in code, which is, of course, very challenging to really understand. Why is this procedure being denied, and how can I appeal it if I'm not really clear on the reason? I want to highlight that this is a really complex issue. There are many requirements for the information that must be included in a denial. And I think what we're trying to call out here is that in addition to those requirements, the denial is for the consumer. And so it does need to be designed with the consumer in mind. Next slide, please. I'm going to hand it back to Lavinia.
Okay, so health-related services is another topic that is confusing for consumers, advocates, and community-based organizations. CCOs have flexibility to implement health-related services / flexible services as they see fit. And as a result, there is significant variation from CCO to CCO in the level of support that consumers receive. Note that fee-for-service members do not have access to flexible services. And since half of the tribal members are fee-for-service Medicaid, this tends to exacerbate known inequities. The good news is that starting in 2022, CCOs are required to include information about HRS in member handbooks, and OHA is developing consumer-facing information about HRS to better support OHP members. The September MAC meeting included public testimony that highlighted the same concerns shared by subcommittee members, as well as the limited reporting of HRS, which does not allow tracking of total number of requests and the dispositions of those requests. And this could result in increasing disparities. Next slide. All OHP members are eligible for care coordination, but consumers and advocates have shared that it's difficult to access care coordination services. This is particularly challenging for consumers with complex health needs, who often need assistance finding providers who are both available and have the skills needed. So the example here, and this is a real quote, in trying to discharge a pediatric patient with complex needs, it took 10 calls and an OHA senior administrator to get access to a complex care coordinator. Why was this so difficult? In addition to the example shared on the slide, another member with complex needs reported that after her doctor retired, it took 18 months to find a new one. Can you go back one slide? Let's see. Transitions to pediatric to adult. The next slide. Okay. There were 2 transition slides that are missing, sorry. Moving to transition challenges, families and youth experience challenges in transition from childhood to adult providers. This is particularly difficult for children and youth with special health needs or medical complexity. Here you can see 2 consumers' comments. One is that there needs to be more cross-systems care coordination during any transition from one service delivery system to another. And families are left to start from scratch to find adult providers willing to treat young adults with disabilities. Another type of transition is when service needs of the member changes. Do we have another slide? There we go. So, for example, a consumer who maybe develops a comorbid condition. Let's say they have a mental health need and then they develop a physical need. So this can often involves benefits that change based on the primary driver of the disability. So here's an example. We frequently see consumers who are required to move out of a home because of a new comorbid condition. Example, someone who develops diabetes in a facility that's designed for mental health services. And so one other transition here is, this is other consumer transition challenges. Here are a few quotes from consumers about challenges with care transitions. Again, these include aging out of service needs changes, or CCO to CCO transitions, or fee for service to CCO. So lots of different points of transition. None of these should happen without first developing a plan with the consumer to minimize that service disruption. From a consumer perspective, members and families are left in the dark about what will happen and how to plan for not knowing what services and benefits will be available during the transition. And one of the things I did want to mention is that many of these transitions are predictable. You know, children age out, so we know that's going to happen. We know that folks are going to qualify for Medicare. So, these are things we should be able to plan for and try to minimize that disruption. So you have 3 consumer challenges here. The first one, I had someone that needed to leave the hospital with a vent that the hospital couldn't get established with a primary care provider before discharge because the patient was not in that county yet. It was weeks before the new CCO became effective. So that's an example of changing from one CCO to the next. And there's a period of time, here's another consumer, there's a period of time when the consumer just has to hope that the previous PCP will continue to treat until the assignment or selection of the new PCP is established. And that's an example of changing from one doctor to another. And thank you for the CCO care coordination requirements. This is a real eye opener for me since I have recently changed from fee for service to a CCO and none of this was done for me. So this is just another transition, but just a lack of communication about what that transition entails. So next slide. This one's yours, Jackie.
Great, thank you. So the subcommittee spent several meetings brainstorming potential ideas for addressing these challenges, and a detailed report along with the recommendations was submitted to OHA in November with a request that the recommendations be considered in future work, contracting, and program requirements for all organizations that serve OHP members. So I'll start walking through the recommendations now. The recommendations related to communication were focused on provider search tools, denial notices, health-related services, and care coordination. So for provider search tools, the recommendation is to develop standards for provider search tool functionality. And there are a lot of good examples out there. For the other three areas, the recommendation is to develop standardized consumer-facing plain language materials, allow room for CCO-specific details because we know that healthcare delivery is local, and really importantly, to involve consumers in the work and co-create in multiple languages. Really quickly on the previous slide, you don't have to go back. I just want to highlight that as I said before, there is work underway to improve the consumer friendliness for denials, and there's also work underway to create those materials for health-related services. So back to you, Lavinia.
Yes, in terms of recommendations for care coordination and complex needs, care coordination can be especially helpful for consumers with complex needs. The recommendation is to set clear expectations for all organizations involved in care coordination for both the CCO and fee-for-service OHP members, and promote care coordination services to support consumers who experience challenges finding providers who are culturally appropriate and have the skills needed to best serve the member, and to develop a method to track wait times by provider type and engage the MAC in monitoring those wait times. So those are our recommendations. Next one, our recommendations. Next slide, thank you. Next, these are recommendations to improve care transitions due to changing needs. To improve transitions of care across systems, for example, from CCO to CCO, or when consumer health or social needs change, our recommendation is that we require that a plan be in place before the transitions happen. For example, a youth who transitions to adult services, adults who become Medicare eligible, or when moving from one CCO to another CCO, or from a fee-for-service to a CCO, and when service needs change. We also recommend that we use care coordination to find services and supports to meet consumer needs and minimize disruptive changes to the consumer. That should be the ultimate goal. Note that the 1115 waiver application includes a policy concept specifically focused on transitions, particularly with respect to protecting benefits across transitions to ensure that consumers' access to care is not disrupted.
So as we mentioned earlier, there is limited visibility into consumer experience information and unfiltered consumer voice. So the recommendation here is to increase the focus on consumer experience. There is a lot of great work across the agency and across CCOs to actively engage consumers. We found roughly a dozen sources that each provide a facet of consumer experience, including CAHPS survey findings, grievance and appeals data, and many committees and councils that include consumers. The recommendation here is to leverage all of that work by developing a centralized structure and agency-wide approach to consumer experience in order to capture, analyze, and use the information to improve consumer experience. This work really importantly needs to be done with a focus on advancing equity and needs to include consumers and ensure visibility into consumer experience by race, ethnicity, preferred language, disability status, and age. There are a few more slides about ongoing work of the subcommittee and how some of this work connects to the waiver work, but maybe this is a good place to pause for some questions and comments.
Thank you, Jackie and Lavinia. Certainly if members have any questions or comments, please feel free to raise your hand or unmute yourself. I don't want to jump ahead, certainly, but some questions are coming to mind is how will you guys be monitoring any interventions that are implemented from your recommendations? And if you're going to speak to that in next couple slides, we can pause that question. But just kind of curious, what are the next steps with implementing these recommendations? And is MAC and the subcommittee overseeing this, or who is responsible here?
Yeah, great question. So I think the first step would be, some decision from the agency about what recommendations are going to be received or accepted. We've certainly started to do some of the work that we can do we haven't started, but the agency had already started work on the denial process. So I believe that is coming back to the MAC in April. And there is work underway, as we mentioned, to create some consumer-facing language around health-related services. I think some of the other recommendations are going to require more collaboration across the agency.
Great, thank you. And then is there plans to, and just I guess for everyone's awareness, is there a schedule and plans for collecting consumer feedback on a regular basis and comparing that to what you find in the recommendations here?
Yeah, I'll try to answer that question. So I would say there are lots of plans. There are lots of different activities that engage consumers, as we talked about. But there's, as far as I know, there's not really a centralized repository, so to speak, or way to manage all of the incoming information that we receive so that it can be analyzed collectively. And I think, that's really sort of what we were looking for in the early process of the subcommittee work, and one of the things that we thought might benefit consumers. I do see a hand up.
Yeah, it looks like, I think Kirsten popped up on her video first. I think she had a question or comment, and then we'll go to John Santa.
I feel like I cut the line, John, sorry. I was curious. I thank you so much for this information and the work behind it. Navigating the different acronyms and agencies and entities at work here. Certainly, I am sensitive to those challenges, and I think your examples articulated it well. When you talk about centralizing consumer experience, and I do appreciate kind of the intent here to be like, how do we raise that up and address it in a better way? When you talk about centralizing it, is that something that you see happening on the back end? You also mentioned kind of a lack of unfiltered information. So I guess I'd love to hear a little bit more about how that centralization might be seen or not seen from the consumer perspective. Are we going to ask, are they going to get another piece of paper in the mail, or how do you achieve the goals here?
I think that's a really good question, and I can't say I have all of the answers. I think one of the recommendations here is to certainly involve consumers in the work for how this should look. I do know that one of the things the subcommittee talked through is we need to do this in a way that, one, offers opportunities for all consumers who want to share information to do it in a way that is comfortable and convenient for them. So whatever format, whatever time of day. Right now we have a lot of public meetings that testimony is welcomed in, but that's not always the preferred maybe vehicle for consumers to share information. So I think it's worth asking, how do you want to share information, again, at a time and in a format that's comfortable and convenient for you. But I think beyond that, Kirsten, this is really a big job. This is not, it's easy to put the words on a slide, but the work involved is much bigger than that, of course. So I think answering that is going to take a little bit more work.
Thanks. John Santa, see your hands up.
Yeah, thanks, you all. This is really thought-provoking. My first question is around kind of the content issues that you raise. At OHA, is there a centralized content group? You know, I think back to my experience at Consumer Reports where, you know, there was an editor for the website. There was a content editor. You know, we had really strict rules about language we could use and not use, when acronyms were permitted. And you know, that group's job was to make the content as understandable as possible for our customers who were consumers. It was a very hard job because, especially on the website, oftentimes what we discovered was older web pages would not be taken down. So there was, you know, there was always a surprise when the web folks, well, we didn't take it down, but we didn't think anybody really could get to it, because they couldn't anticipate what search terms people would use. So, you know, I think sometimes it takes a mindset change to realize that essentially the website is a communication piece. All these things that go out are communication pieces, and a communication team really has to be given control of them. Again, for example, the fact-checking people were very powerful. You know, they would look at content and go, now, wait a minute, you're saying that this is a fact and it isn't. You know, we can't find any proof that this is a true statement any longer. So, you know, is there any kind of content group? I mean, when I see this comment, it looks like the most influential folks are the lawyers, because a lot of this looks like, you know, legal language and terminology, you know, rather than content that's designed for real people to understand.
Exactly. Yeah. We concur with you on that. I think that, you know, plain language is, you know, the terminology that we've been told, you know, trying to put this, well, as Jackie was talking about, you know, really, who is your audience here? If it's a general consumer, then references to all of those codes and numbers make absolutely no sense. So I think having some sort of standardization too, when it comes to denials and things that are designed for the consumer to understand and then act on, I think is really, really important. So we concur. There should be some sort of oversight, I think, of all of this.
Yeah, the other issue I would ask about is some of these appear to be with the fee-for-service process. Some appear to be with the CCO process, and it would be good to clarify what's going on there, because I would assume that they could be approached differently in terms of getting them solved. So you might think about looking at these impressions and how many of them were you know, fee-for-service experience versus CCO experiences.
Yeah, that's a really good point. I just want to go back to the previous question about, you know, work to centralize things. There's a lot of great work going on across the board on the communication side. I think part of the challenge that we have, though, is that we have so many different entities that are involved in communicating with OHP members. And so how do we get some consistency in terminology and format and how we're sharing that information, again, so that it is very consumer friendly. So.
Thanks, Jackie, for that follow-up comment. Thanks, John, for the question. I see Oscar, you have your hand up.
Yeah, thank you, Tara. Good morning. I just want to say thank you so much for this great webinar and this information. I have a question, regarding some of this. I can't even imagine how difficult it would be for somebody whose English is not their first language or not a dominant language. This could be very, very challenging. I'm wondering if, as part of your recommendations, I see you sort of call out, language here, but is there an idea to actually have CCOs or encourage CCOs to work with BIPOC-owned businesses that could be doing a lot of this translation, or that could be doing more consumer engagement in terms of the best ways to reach populations whose English is not their first language?
Yeah, so one of the recommendations on the consumer-facing material side is exactly that, to co-create, to involve consumers and co-create in multiple languages. So I think your question is spot on, that we need to make the information accessible to everyone.
Yeah, but I think for me, it's more about it's not in addition to consumers. I would say that there's a lot of communication businesses out there that are focused on targeted populations that are consumer facing. So in addition to the consumers themselves, again, also reaching out to whether it's, BIPOC owned businesses focused on communication that can be helping co-create these messages in this language.
That's a great call out and a great suggestion. So thank you.
Great, thank you for those questions. I'm not seeing any other questions right now in the chat. I'm not seeing any virtual or real hands up. So I think we can continue and certainly have some time at the end for additional questions and discussion.
Sure, great, thanks, Tara. So just really quickly, the next couple of slides provide an overview of work areas where the subcommittee is continuing to try to get a better understanding of consumer concerns and to develop recommendations. So this is ongoing work. Next slide, please. Consumers shared challenges with service denials that are in conflict with the goal of whole person care. And we've got two examples here. One is where a procedure is denied that would enable a consumer to remain employed or be able to work. And then we also heard that a common occurrence is mobility devices for children with special health needs are denied, and that the denial occurs because the equipment is not seen as medically necessary. It's seen as a convenience item for the caregiver. So the committee next steps would be to continue to research how consumers experience these issues, research innovative models in other states, and we hope be able to develop recommendations for addressing these concerns. Next slide, please. We also heard a lot about challenges with access to specialty care, including inadequate capacity for certain specialties or geographies, limited appointments for individuals covered by Medicaid. And then the specific concerns or the areas that we heard about were neurology, psychiatry, cardiology, pain management, and treatment for eating disorders. I do have a quote here, it's not on the slide, but someone shared that in the last 4 years, I've heard OHP patient quota full. OHP does not pay for visits beyond initial eval, so we don't take OHP patients, and we are not contracted, even though through the CCO records, this member indicates they were. So our next steps here would be to do additional research to better understand how consumers experience this, develop a method to track wait times by service and provider specialty, and then collaborate with other committees as appropriate. This is certainly a big topic. So next slide.
So the next two slides highlight consumer challenges where the 1115 waiver is one possible tool for improving consumer experience. The MAC and the subcommittee appreciate the work that waiver teams have done to incorporate this information into the waiver policy concepts and application. So this one has to do with transitions. Transitions too often lead to a loss of continuity. The system needs to be better at ensuring service availability. We need a consumer-centered plan to minimize disruption of services. So here it's saying that consumers experience benefit loss and access challenges when transitioning to Medicare and or dual coverage. Consumers report it feels like a penalty when you become eligible for Medicare. And I've heard that in several different, several different people. Our waiver goal here is that they have put into the waiver is that OHP coverage is preserved as patients transition across the systems. So there are multiple policies proposed in the waiver application to preserve coverage during this transition. So we think this is an opportunity to address this issue. Next slide. In terms of social needs, there's an increased awareness of the importance of social determinants of health and screening for social needs. Funding has increased for referral systems, for example, Unitas or Aunt Bertha, which in turn has increased demand for social services. However, funding for social services themselves has not increased to meet the growing demand. So it's almost like you increase demand without increasing supply. So working in social services myself, this is something that there is great concern about. We know there's a need out there, but we think that focusing on social determinants of health also needs to look at increasing funding for those social services. Sorry, go ahead. Any discussion?
Yeah, I'll just reiterate that the folks working on the waiver have really done a great job of incorporating feedback. So we certainly appreciate that.
I see John Santa has his hand raised. John, please go ahead.
Well, it's been an eye-opener for me as part of another activity to realize the challenges around the Medicare interface. I'm a little confused about these folks that are in transition, because basically we should have some folks who go from being just Medicaid to being Medicaid and Medicare. I'm not quite sure I understand if we have how we could have folks who go are Medicare dual eligible. Do we have folks who go from Medicaid to only Medicare? And this is always bothersome, because it's like if they go from Medicaid and now they're in Medicare care, but they're still eligible for Medicaid, they're dual eligible. So they should have better coverage, and yet they don't, because Medicare comes first. I mean, I've learned, for example, that Medicare really has an inferior mental health benefit.
Yes.
And so these folks are, I guess, coming across as, oh, you're in Medicare, we no longer want to see you. Well, but wait a minute, they're dual eligible. So isn't Medicaid paying for what Medicare doesn't? So how does that happen? I just feel, ignorant about how can it be worse when now they have two sources of coverage, rather than one. But so maybe I'm missing something, but I'm trying to figure that out for this other activity also. So that's one thing that really caught my eye, and I think is very frustrating and interesting.
So I think I agree. On paper, it would appear that, or it would seem that they should have better benefits when you have two, right? But when Medicare becomes primary, then during that transition, when Medicare becomes primary, and you have the secondary being CCO or Medicaid, there is a disruption in services until that's all sorted out, and that could last for several months. So I think that's the concern. So we know these are going to happen. We know a person is going to age into Medicare. We know that they probably will continue as a dual. Yet for some reason, this happens every time, and it's not like, I mean, that's the issue to me, is that these are predictable transitions. We should have a plan, and so that there is limited or no disruption in services. I think that needs to be addressed. It just needs to be addressed. But you raise a very good point. It's confusing. One would think that it should be better, but it's not.
Thank you for that question, John and Lavinia and Jackie, for those responses. I want to ask, are there any other questions, comments, reactions from members or staff or anyone from the community or public on today's educational webinar?
Tara, this is Maria. Not so much of a question, but a comment. And again, my name is Maria Elena Castro. I am the lead staff for the Health Equity Committee, which is also a committee of the Oregon Health Policy Board. And our main area is definitely ensuring equitable systems and advancing health equity. I see there are many ways where this information can be amplified by the Health Equity Committee. I see many areas where equity and the consumer experiences intersect. So I feel like this is something that definitely needs to be shared with the Health Equity Committee. We have consumers now in our membership, and I think that there's many things where we can amplify this messaging and work together on ensuring that as we move towards advancing health equity and we aim to eliminating health inequities by 2030, feels that all your examples and your illustrations, I mean, really paint a picture of where just simply focusing on enabling equitable systems will definitely do incredible work and definitely support our goal of advancing health equity.
Great.
We would love that. We would love to collaborate. So thanks, Maria.
Yeah, thank you, Maria, for that comment and for being open to that. It also reminds me that the Health Policy and Analytics Division, along with OHA Communications and the Office of Equity and Inclusion, recently released an updated style guide on language and communication. And just speaking to John's comments earlier, that's an OHA agency style guide, and that is certainly something that other agencies could benefit from having exposure to and applying to their written and spoken communication to help create some plain language and common terms and understanding across all the different communications that come from various agencies. So Maria, thank you for the offer and the call out, and for Jackie for Mac being open to that. I see Lisa Bowie has her hand up. Lisa, go ahead.
Hello, can you hear me?
Yes.
Great. Thank you again, Lavinia, Tara, and Jackie. A couple thoughts on the recommendations and kind of some next steps. One would be when you're looking at, I'm happy to partner with and probably include Maria and others in this. When we look at the specialty care recommendation and the limitations that we hear around that, there's some things that we can do from an analytical side to also to further flesh out the kind of the problems to support the feedback we're hearing, which is probably no surprise to many of us. And the other part would be another partnership. As Marie has mentioned, I can help facilitate a conversation around the use of that consumer experience information, whether it be the CAPS data, the complaints and grievances, the NOABD, you know, all those acronyms that we speak, but it's not, basically it's what I call the patient experience, the member voice, and how to put that in front of the CCOs. We can do that through our Quality Health Outcomes Committee meeting, which we would welcome the partnership of the community voice from this group or recommendations to help the CCOs see how to also use and integrate that better into their practices.
Excellent. I love that. Thank you.
I'll read through the full recommendations, but thanks very much for the highlights in the presentation.
Great. This is awesome. The educational webinar is also turning into a collaborative effort to continue this work. So that is a great outcome of this educational webinar beyond providing this information. We have a few more minutes, so I'll continue to welcome any additional questions, thoughts, comments from members and other folks attending today's educational webinar. And certainly, Jackie and Lavinia, if there's any final thoughts or closing comments or anything that you want to make sure that you share today, I welcome that as well.
Yeah, I'll give it a go. This probably, I won't articulate this well, but I think the underlying premise of this work is that really consumer experience information is a transformational tool. Like, we have such a great opportunity here to leverage what consumers can tell us to help us in how we design and implement healthcare policy and programs in the state.
Thank you. Thank you, Jackie. And again, thank you, Jackie and Lavinia and the MAC and the subcommittee for this important work. And thank you to Maria and Lisa, who are going to help shepherd this and make additional connections on these recommendations to ensure that this information is widely disseminated and acted upon. I think I'm not seeing any additional comments, hands up. So we could certainly deploy a meeting best practices of ending 5 minutes early so that everyone can stand up, stretch, get some fresh air before you log into your next virtual commitment. Oh, let me pause 1 moment. I see Lisa has her hand up again. Lisa, did you have an additional comment?
Or, oh no, I was just
you're clapping
for the
okay.
best practices.
Okay, then I don't want to let you down. So thank you, everyone. This recording will be posted on the board's website and available at a later date, starting probably tomorrow or the next day. Thank you for participating and have a great day. Bye, everyone.
Thank you.